Bed sores. Today we're going to talk about bed sores that could occur in a hospital, in a nursing home facility, in a long-term care facility. But if you don't know what those are, bed sores are otherwise known as pressure ulcers, and they're sores that can develop on someone's body due to a variety of factors if a hospital or a healthcare facility does not do certain things to make sure they don't occur. Welcome back to the Williams, ELLEBY HOWARD EASTER YouTube channel. I'm Joel and this is Mark. So let's jump right into it, Mark. You want to just tell us basically what a bed sore or pressure ulcer is?
Sure. So a bed sore, the fancy word for it is decubitus ulcer, but we call them bed sores. If you can imagine just putting your finger on your skin for a period of time and then taking it off, oftentimes a white spot will appear, a red spot will appear, and that's because you've cut off the blood flow to the tissue. Now if you only do it for a second or two, it's not a big deal, but if you do it for a long period of time, the tissue in your skin will be deprived of oxygen and it'll begin to die. And if it gets out of control, then that can cause really bad problems, even in some cases, infections that go down to the bone. Yeah,
and this is a problem that is very well known in the medical industry. There are protocols and things in place, especially when somebody is immobile or hospitalized for an extended period of time. These healthcare facilities know that this can be a serious issue, and most hospitals have protocols and rules in place that must be followed in order to minimize the chance of a pressure ulcer happening. The first thing that hospitals are supposed to do is identify which patients are at high risk for acquiring a pressure ulcer. And they use this scale, it's called the Braden skin scale. They evaluate 6 different factors to determine whether someone is high risk. And those factors may be sensory perception, skin moisture, activity, mobility, friction and shear, and nutritional status. And based upon what this Braden skin score is, they'll know, okay, we need to take extra precautions for this patient, or this patient's not really at high risk of developing a pressure ulcer, but then they have to develop what we call an individualized plan of care for that patient. So do you want to talk about that?
Yeah, so the plan of care depends on these factors. And if you can imagine someone who's up and walking around, they're at low risk, they probably don't need any interventions. But if someone is immobile because of surgery or because of they're a feeble person, if they are on a feeding tube and might not be getting the amount of food and nutrition in their body that will help their skin be healthy, if they're incontinent and are wetting the bed, the liquid and the friction on the sheets can, think of yourself when you get out of a swimming pool or the shower, your skin is hard to rub against and the friction's there. So the type of interventions you might do are make sure they're getting their nutrition on a regular basis, make sure you're giving them fluids, make sure you're changing the bed seats, make sure that you are turning them. There's other devices that can be used, such as air mattresses and types of beds and pillows that might elevate things like a person's heels off the sheets.
Yeah, and that's a good point. A lot of times, well, at least in my experience, the most common places that I get calls about where parts of the body where people develop these ulcers is their heel, they're right above their sacrum where your back gets to your buttocks region, and then even the back of the head or the elbows, because those are points of the body when you're laying down for a while, if you're not turned and all of that are going to come in contact with the bed without being moved. And all of these things are important to consider from a medical provider standpoint. The most common areas where you see this pressure at, as well as what you do to try to prevent it. And one thing that's always interesting to me is when you have a pressure ulcer case, who are the possible defendants? Like, who are we looking at to see who messed up? Are we looking at a doctor, a nurse, a dietitian, a tech, or what? What's the first place you look, Mark?
I look first, it depends on the context. Was this a nursing home or was this a hospital? Because a skilled nursing home has a lot of regulations that they have to follow, a lot more so than a hospital. So first you look at where were they. But another thing you look at is, was there a medical assessment done at the outset? And that could have been done by a physician. It could have been done by a medical director of skilled nursing facility. It could have been done by a nursing specialist. Typically, once that assessment is done using the Braden scale and others, things will be put in place. You also look to see, maybe did a doctor order food at the right intervals, fluid at the right intervals. Once that plan of care is established, though, then you might look at either the nurses or the certified nurse assistants or CNAs, because they're the ones responsible for implementing this. And you might look at, were they turned every 2 hours? Did they get their meals on time? If it's a patient who can't feed themselves and needs to be spoon-fed, was that done, or was the plate just put in front of them where they can't reach it?
And also, if they're not even at the point they can be spoon-fed, if they're being fed by a tube, there can be issues with whether they're having intolerance to that, or whether they're positioned correctly when the tube is placed into their mouth and down into their stomach. Because if that's not done properly, it could cause somebody to aspirate or not get the nutrition that they need. And one very important thing, or one very important variable in any bed sore case, is skin integrity, and part of that has to do with nutrition intake, to make sure that you're getting enough protein, to make sure that not only are you being turned, not only are you being bathed, but also you're getting the nutrition you need to keep your skin as healthy as possible, so that you're not more susceptible to having it break down. That's why a lot of times we see someone who may be a quadriplegic or paraplegic who can't move like somebody without a disability can, develop bed sores more often than others. And it could just be the nutritional status.
Exactly, and that's what you look at. You look at the underlying conditions of the patient too, because sometimes it might be people with diabetes. Unfortunately, it's much harder to prevent bed sores than people who don't have diabetes. People who cannot be moved for a particular reason because it might cause them heart problems or something, it becomes harder to prevent. So you look at all these factors to see, could this have been prevented if they had had good nutrition, if they had been turned, and what were the things that were preventing those from happening?
Yeah, exactly. So, and it's also, you look at this coordination of care, right? So there could be cases where you have nurses that are kind of in charge of making sure these things are going on, but then also there's other members of the care team. There may be dietitians involved, and you may have to look and see, okay, did the dietitians provide the right nutrition to the patient that the doctor's ordered? So like the doctor may say, okay, we need X number of milligrams of this supplement X number of times a day, and then the dietitian is in charge of going, okay, well, here's what we're going to give. The nurses would then obviously give it. And then you go back and look and say, okay, well, if there was a problem with that, or did the dietitian do what they were supposed to? All of those things play a factor. One of those things that you look out for is weight loss, right?
Yep,
so if somebody has dramatic weight loss, then that's a significant sign that they're probably not getting the nutrition that they need. But there's a lot of moving parts to it, and a lot of different places to look at, and a lot of different things that can be messed up. But generally speaking, if the rules of the hospital are followed, or the nursing facility, and nutrition is given, and these steps are taken to minimize the risk that somebody could develop a pressure ulcer, they usually don't develop. And when they do develop, when the rules are followed, it's normally, like Mark said, because there's some other medical condition that is limiting the provider's ability to take these steps that should be taken to minimize that risk.
Sure, and speaking of those rules, nursing homes typically are guided by the Medicare regulations because they have a high population of people who are receiving Medicare. And those regulations require that certain things be done. It's not just the Braden scale, but it's that you have to meet certain standards in order to have your license to continue being a nursing home. And it's sometimes helpful. You can get online on the Medicare website to see, if you're considering placing someone in a nursing facility, whether those regulations are being violated by a particular home on a regular basis.
That's right. All right, so we've talked about the development and prevention of bed sores. But when they do happen, there's also things that should be done to treat them, to minimize the chance that they could become because they can become life-threatening, especially if they get infected. see last week's video for infections. But there are, when you have a big hole in your body, basically, then there's the opportunity for all kinds of bacteria and bad stuff to get in there and cause an infection. So do you want to talk about what happens on the back end, like once a pressure ulcer has already been identified?
Sure. Prevention is one of the halves of the equation, but the other is what was the response once a bed sore occurred. Looking at what they did might be, for instance, if a person is incontinent and a bed sore has developed, are they making sure the sheets are clean? I mean, if someone's going to the bathroom in their own bed, infection is going to be likely. Were there signs of infection that began that could have been stopped through antibiotics? Was someone consulted, like a wound care specialist? Were other devices used? For instance, we talked about the heels earlier. If you start seeing a little red spot on someone, that's an early stage of a bed sore. You can put a device under the legs to elevate the heels, take the pressure off, and that's something you can do to prevent it.
Yeah, that was the next thing that I was going to go into, is there are different stages of bed sores. Stage 1 is the least severe of all of them, but it goes to stage 4 and even unstageable. And the worse it gets, the more severe it can become. But one question often is, how long did it take the provider to identify that this patient even had a bed sore? And unfortunately, some of the worst cases you see are the ones where all of these things to prevent bed sores, or a lot of them, were not being done. And somebody began developing a bed sore, and it may have started out as the stage 1, but by the time somebody discovers it, it's at stage 4 or unstageable. And then it's much more complicated, much more painful, requires a lot more to treat once it's already been there.
Yeah, and it's crazy to me sometimes when we get these cases and we look at the records and we actually see documentation of a bed sore on someone's medical records, and yet so much time passes before anyone's called to do anything about it. So you have evidence in the records of the sore, but also evidence that nothing was done about it.
Yeah. These cases to me are kind of like retained foreign object cases to this degree. It is almost something that should never happen, with the small exception of some extenuating circumstance that does not allow the medical provider to do these things. Bed sores just should not happen when you're under the care of a medical care professional. But when they do happen, if these steps are not followed to prevent them, or the right steps are not followed to treat them when they do develop, then you may have a case that you could bring against the medical provider. And when you do that, there's certain things that you're going to need. And just like our other medical malpractice videos, the need for experts in this situation is no exception.
Yep. Again, you may need a lot of experts in these kind of cases. You may need a medical director expert if it's in a nursing home. You may need a wound care specialist to talk about what should have been done. You might need someone who's a nurse who's an expert in preventing bed sores in the first place, either in a hospital setting or a nursing home setting. And then you might need an infectious disease specialist if it gets to that point.
Yep. Or a medical doctor, because medical doctors lots of times can talk about what nurses are supposed to do.
Sure.
You can kind of go down the hierarchy of authority. You can't go up. Like a nurse can't talk about what a doctor should have done, but a lot of times a doctor can talk about what a nurse should have done. Or dietitians or anything like that. You may need any of those depending on the situation. But I would say on average, when we're looking at medical negligence cases and whether it's a case that we'll be able to take, we accept bed sores probably more often than we do other ones, just because it's one of those things that really should never happen if your medical team is doing its job properly. So anything else you got on bed sores?
I think that's it.
All right, well, we hope this video has been helpful to you. If so, give us a thumbs up, hit that subscribe button, and we will see you next week.